Now, another factor of stroke, very important, is the family factor. If in your family, 1 or 2 persons have had a stroke, believe me, be careful, you may have a stroke. In my case, my dad passed away from stroke, my big brother passed away from stroke. I have a few persons on my dad's side who had a stroke, and as well I had a stroke. Usually it's when someone had it in the family, then it can happen to you. So you should be careful. Another cause that here is very, very important as a blood pressure is the stress. Stress is a big killer when it comes to stroke. When you stress, if you take your blood pressure, let us say every day is 130/85. If you are stressed, take your blood pressure. I guarantee you, it will be high. I know it's easy to say not to be stressed. We all go under issue in our life, but always try to minimize your stress. Usually, they will say, I was talking with him yesterday, or the wife divorced him, he has financial problem, this and that, and then he died because he's stressed. So stress will kill you. So always try to minimize your stress and lower your blood pressure. Now, other causes as well that I will just read here are lack of exercise. If you don't do exercise, you can get fat, you have blood vessel. Because what I say, exercise is very important. If I take my blood pressure, it's like a 130/80. The next day, if I have like a 30-minute walk, take my blood pressure 100%, it will be lower. Exercise will lower your blood pressure. That is very important. The eating big quantity leads you to fatness, give you cholesterol. So eating the proper quantity as well is very important. If you eat too much, it will kill you as well. You have also something that is very delicate. You won't believe me. Constipation can give you stroke. Why? I will tell you. Some people may say, what is... Because as I said, there's nothing here that I'm saying that I just pick there and there. I have had a proper reading. There are some people who will say, I have an uncle. He went to the toilet. He was constipated. When he comes out, he cried about a massive headache. Because by the way, when you have a brain hemorrhage, the pain you have in your brain, there's no one to describe it. The doctor called it thunderclap. It's such a pain that they put a brick on your head. So in your brain, sorry. So some people go to the toilet, they comes out, they start crying loud about the pain in their head, and then they just die. They had a stroke. Because what happens is that if you are constipated, you go to the toilet, you are pushing too hard. That pressure you are putting on your body by pushing, it puts strain on your blood vessel, and your blood pressure goes high. And really, few persons told me, I had an uncle, he went to the toilet, he comes out, he passed away from stroke. That was constipation, that has led him to push so hard, and then he died. So careful of constipation as well. You have also something called trauma. Trauma is when you hit your head so hard. Okay. Also, the third type of stroke is called, in English they say transient ischemic attack. In fact, we call it in French, stroke ischemic transitoire. It's not that common. What happens in this type of stroke is that you may feel all the symptoms of stroke. Really, you feel like you have a stroke. After a few minutes, 10 minutes, 15 minutes, it's gone. You are normal. But even you have this, make sure you seek medical advice because it will come back. A stroke will try to hit you, maybe you feel paralyzed, you can't talk or whatever. Then, if it happens, seek medical advice on this type of stroke. Okay, I won't be too long. I'm trying to be quick to let the body speak. Now we are in the symptoms. Symptoms vary to, one person to another. You don't need to have too many symptoms to say you're having a stroke. Some people may have only one, some people may have two, some may have many. Now, in my case, for example, I have only 2 symptoms. I have a massive headache. And then I vomit as well. When this thing is happening, you must know your body. Don't let anyone tell you, oh, it's nothing, we think it will be fine. If you feel that something is going wrong, your speech is changing, you can't see properly, seek medical advice. When I was having a stroke, I called the emergency, to paramedic came, the ambulance. She took my blood pressure and she said, oh, the blood pressure is fine, you can stay home. I said, what are you talking about? I'm dying here, I need to go to the hospital. She was trying to tell me to stay home, that is okay. Because she thinks that when your blood pressure is okay, you can have a stroke, which is wrong. So it's you who know your body. Don't let anyone tell you, oh, everything is fine. So we have then, you can have a headache, you can lose the vision, you can lose the sight, you can lose the speech, you can have the one side of your body get paralyzed. So there are many signs of stroke. You can have anything as well to see, to have more. Okay, you can have vomiting as well, as I said. Okay, let me carry on here. Now, prevention. What can I say about prevention to prevent the stroke? Something very important as well is, first of all, I will say you have to eat healthy. Because if you don't eat healthy, all this junk food we eat every day. When we cook a pondu, we put palm oil inside. When you have this macdo, we eat every day. This is fat. This is a lot of fat that is going to build in your body, and then it's going to create this what is called plaque in your blood vessel, and then it's narrowing your blood vessel, and blood cannot go through properly. So eat very healthy is very important. Then you have to check your blood pressure, which is very important. You have to avoid stress. I'm just trying to say what I said before regarding now exercise as well is very important to prevent stroke. It is saying that if you walk about 30 to 35 minutes, at least 4 times a week, that can help you as well, to minimize your risk of having stroke. Drink a lot of water, eating about 2 or 3 food every day. Also minimize your alcohol intake. I will finish by saying that take your health into your hand. You must know your body. We have the car. We change the car tire, we change the engine oil, but some people don't bother checking their blood pressure, checking what is not going okay with them. So you must try to make sure that you are okay. Definitely. You can, even you go to the GP, you say, oh, I want to check this and that. He may say, oh, it's okay. You can say to them, few people die in my family from stroke. Then they will check you properly. That's what I do. If I want my liver to be checked, I will tell them that 2 uncles from my side pass away from hepatitis. Then they will check me, check away properly. So make sure you get checked. It's very, very important. Also, be very careful of what you are taking on social media. People post out there some nonsense. These days, I saw a post who was saying that if someone has a stroke, take a needle and pierce the finger, and then it will really, really help. And thousands of people will say, thank you for the post. So be careful of what you are reading on the social media. It may be really misleading. Thank you so much to have taken your time to listen to me, and I hope stroke will be behind you in Jesus' name. Thank you.
Thank you very much, Jules. It was very entertaining.
Check your blood pressure. They are welcome. I have the machine with me.
Brilliant, perfect. So now, Jules will take a couple of questions. I don't know if we have any questions in the assistance, but if you have any questions, just raise your hand so that we can do this quickly and then move on to something exciting. Yeah?
It's not a question. I'm just impressed, to be honest. I'm speechless. The presentation was above standard. For somebody who is not medically trained, for such insight, you really need an award. Keep all the good work. Yeah.
Thank you. I'm a GP. Not really a question, it's just to say how well presented you did today. And you made a very pertinent point about family history. That's one of the ways to get your GP to do stuff. You can say, I want a blood test for a liver. They're going to tell you there's nothing wrong with you, so take paracetamol. So, yeah, talk about your family history, it's going to be a reason for them to do it. Thank you.
Thank you for your input.
As also to say that GP knows, but sometimes believe me, these GPs, they just read the books. They just apply what they have been told. When my daughter was 6 months old, a GP prescribed her a medicine because I always read. I don't just take anything for granted. The medication was for not under 10 years old. And my baby was 6 months. If I didn't read, I should have given her that medicine. Something may have happened. So it's to say that don't take all the things that the GP will tell you for granted. You may also check. Google is one of the big doctors. Even on Google, you have people telling nonsense there. So really make you some research, read, look around you, and take your health into your own hands.